I'm Greg Wheatley, and my guest today on Inside Wheaton is Dr. David VanDyke. Dr. VanDyke is the director of the Marriage and Family Therapy program at Wheaton College and associate professor of marriage and family therapy here as well. David, it's great to have you with us.
It's great to be here, Greg.
And nice to meet you.
Nice to meet you.
The program itself is new.
That's correct.
A couple years?
Yeah, it started in 2012. We had our first incoming class. The master's program at Wheaton has been in existence since 1976. Fran White started that coming off the mission field and felt called to minister to families and individuals through counseling. So she was given the word of Isaiah 61, which we've kind of embraced as our verse section for the marriage and family therapy program. The history of the master's program in Wheaton for mental health counseling, it started out as a counseling degree and then changed in the 80s to a clinical psychology master's. And then recently, with that, neither licensure, the LMFT or the LCPC, wasn't being met by the master's degree. So we've developed two new master's programs, a master's program in marriage and family therapy and then in clinical mental health counseling.
Talk just a little bit, David, about the difference in those, the meaning of clinical psychology versus counseling versus therapy. I mean, just help us out as
Sure.
lay people just a little bit.
Yeah, the clinical degree here at Wheaton College is a PsyD degree. So it's a doctoral degree where they're working on not just clinical skills, but research, scholarship, and assessment. The counseling degree is more individual-based, focusing on what's happening within the individual. They do family therapy, but the way they conceptualize brokenness, healing, health, pathology is more from an internal experience. And then family therapists, it's not just working with more than one individual in the room. It's really how we conceptualize sin, brokenness, pathology, and healing. And it's relational. And so it's looking at how the context, how relationships shape our experience and provide then how we feel, how we think. And so we focus on the relational part. It's both and. It's the individual and context. And our degree program emphasis on the context part.
It's interesting, as I was looking at your website and your college web page, some of those words jumped out at me. Some of the things you're saying now, experiencing God in relationship or in community.
Yes.
I loved the phrase, and I don't know if you wrote it or your press agent, but which I suspect you don't have those.
Yeah, no, it's probably me.
Probably yours. Relational dances.
Yes.
That's very, very colorful. Talk about what you mean by that.
I would think about maybe a fight a couple might have. A husband and wife are fighting about who takes out the garbage. I know that never happens in the Wheatley household, right. But it may happen in
garbage disposal.
That's exactly right. But an individual perspective might be, well, if the husband would just do it, the wife wouldn't have to nag and the garbage would be taken out. A different way of punctuating it is if the wife wouldn't nag, the husband would do it and the garbage would be taken out. A systemic perspective is it's the dance that they do of the complaining and the resisting, and it's not either or, it's both and. It's the dance that they do around, because it's more than taking out the garbage. It's about being heard, being seen, and how they're doing the relationship. The behavior is a function of how they're doing that that relationship. And so it moves from a linear kind of idea to a circular idea.
So let's stay with that kind of mundane example, although it's not mundane when it happens. If you stay with that, I suspect then what you're saying is your counseling would not be, well, look, husband, just suck it up and take this out. You'd want to look more deeply at what was going on in that dance.
Correct. We'd look at the dance. We'd look at how are they connecting? How are they able to be vulnerable with each other and be known? What does taking out the garbage mean to each of them? And how is that being expressed in the nature of their relationship? Because I'm sure there's disappointment, there's expectation, and it's unpackaging that the dance goes around. And a lot of times what we see as marriage and family therapists, there's people coming in doing lots of different dances. Another one is spilt milk. Is another kind of mundane one. But let's say there's tension in a marriage and a child spills the milk, right? All of a sudden, both parents can look at the kid and see what's happening and get upset about the milk. Right. Enough repetitions of that, the child's misbehavior becomes a function of the system, and it eases the anxiety between the couple. And so our job as marriage and family therapists is really look at what's the relational dance in the couple, in the family, and how is that maintaining the problematic behavior. And it translates into integration of our faith and how we think about ourselves as relational beings.
Just a second ago, you used some words like brokenness and sin, and I'm assuming that a lot of mainstream counselors who are not Christians would have no room for words like that. Maybe I'm wrong.
Right, and then with them, I would say pathology.
How do you counsel differently for a family or a person who comes in and says, clearly, I'm a believer and I need some help here, and someone who comes in who has no religious affiliation whatsoever?
For me personally, I think it's a language issue. It's not so much a relational issue, and I'm going to come around at that question in a little bit distant way. I think about integration really as second order change. So if we have a dance that's going on and we're stuck in that, pathology is going to be that stuckness of how we relate. For us as believers, we look at, we're bound by sin. Because of original sin and the sin we contribute, we're stuck in a relational violation with God. And there's nothing we can do. The dance that we have, there's no ability for us to choose outside of that. We're stuck. Right. Families are stuck. It might be pathology, depression, anxiety, conduct behavior by a child, infidelity in a couple. They're stuck. And the patterns that they've developed are from family history, what they've experienced. We only can know what we can know. The only way out for us as believers is the redemptive work of Christ. And there's a second order change. All of a sudden, the context has changed, and we have new possibilities for relating differently with God through Christ. As a family therapist, whether I'm working with a believing family or individuals that believe in Christ or not, I see myself as coming in, and my students and professionals coming into the system and shifting the system so that there's new possibilities. Will they choose those? I don't know. But from an internal standpoint, I see myself being Christ-like in that context. With people that have shared faith, we would probably use the same language. When I'm working with a family that might have Muslim belief system, Hindu, agnostic, the language I use is different. But the truth and how I engage in the system is the same.
And as far as you're thinking, I mean, without verbalizing it, you're still thinking the same things, that you want to enter into the middle of this and be of help.
Right. And it comes from, when I was being trained at Fuller, had a class with Ray Anderson on Dietrich Bonhoeffer. And it was really that space in between. For me as a believer, entering into relationship, I bring the Holy Spirit into that space. And so it becomes a sacred space, regardless of what the other's response is. And that's been very powerful for me as a clinician, as a professor, of having that partnership and that relationship enter in to the relationships I have.
You also are involved, David, as a counselor at Summit Clinical Services, so you have that sort of that professional outlet and then the teaching. Is that true of most professors? I mean, would most professors of counseling or psychology also have their own practice going, right?
Yes, in the graduate school, in the psychology programs, whether it's PsyD, CMHC, or MFT, the faculty have release time to either do research or do clinical practice. And those of us at the master's level mainly keep a clinical practice as well as our scholarship. And it's really beneficial for both the students and the families that we see. We're practicing what we preach, and we're also being informed by what we teach. And so for me, it's the best of both worlds, that the clinical practice informs my supervision because I'm working with families. It helps me stay really connected with then what the students are going through. I can have empathy for them, challenge them in different ways. And then the teaching of the best practices of what's out there in the research and the scholarship inform what we do.
How would you, as you meet with families and individuals now, what's different, say, from a generation ago? I mean, humans are humans. Mm-hmm. Or would you say that, or would you say, no, we're seeing some really new, to use your word, pathologies?
Yeah. I don't know if it's changed as much as the context has changed. The process is really similar. There's still, we are all seeking escapes from intimacy. It gets too much and we seek escapes. In the past, I think a generation ago, 50s, 60s, we were looking at alcohol as a substance for escape, workaholism as escape. That's still there. Technology has shifted, that there's a lot more escapes with technology for kids in terms of really good social skills and relational intimacy. Technology has been a big transformative issue, and we see parents struggling with how do you monitor technology and access that kids have, not only their own technology, but what they're exposed to of other kids at school, showing videos, showing pictures. So there's the exposure to that material, but there's also the experience of technology as an escape. And you can think, for our generation, thinking of TV as that, right? We just go into TV and we escape. Now it's everybody's personal device. Even walking down the hall, it's hard to make eye contact with students because they're deep into their email, text, watching Netflix.
Yeah. Now, you kind of subsumed all of that under this, how did you put it, escape from intimacy? Escape from intimacy,
yes.
Is that the umbrella thing in your mind? Is that really what we're all sort of doing?
I think so, on a very on a spiritual level and a relational level. If you think about the violation of relationship with God, it's about hiding, right? From the Genesis story on, we start out naked and not ashamed. Right? We'd be very uncomfortable sitting here fully knowing each other. Yeah. And we cover up, we escape, we find ways of avoiding being fully known because we don't like what we see. We realize the violations that are there. And so I think from a spiritual level, we see that. And I see that in my practice, and I see that with families in churches that I come alongside, that we escape intimacy in lots of different ways. And being fully known and being fully vulnerable with each other is very difficult.
Mm-hmm. So you're going back, and this is where theology and psychology meet up, isn't it? Because you're looking at basically the garden experience and saying we have inherited that, if you want to use the word pathology, or sin.
Brokenness, right? Sin, however you want to frame it. There's a violation that's happened. And yes, we've inherited, and we've actually gotten better at it probably, and continue to practice it. And so the challenge for a marriage and family therapist is really helpful, because the theology and the theory fit well together, not only on the idea of relationship, but on the image of God. When we look at what it means to be a person from a family therapist perspective, it's recursive, it's relational, it's that I-thou that Martin Buber talked about, that it's that space in between that our humanness exists. Just as in the Godhead, part of being in the image of God is we have a triune God that's in relationship with himself. And so our image of being relational beings flows from a Trinitarian perspective.
Mm-hmm. I usually, when I have someone across the table here who's in your discipline, I usually ask them in one way or another, how do you help people get over the hurdle of coming in for counseling? I mean, that's still hard for a lot of us, isn't it?
It is. It's interesting and I think in the United States, it's more difficult than internationally. I've been consulting with mental health professionals internationally, and family therapy is very, very attractive. Mm-hmm. I was just down in Brazil, and people want to come in with their families and talk about relationships. It's just a cultural acceptance. And I think in the States, there's more acceptance to marriage and family therapy. It sounds safe versus psychology, which seems to be a threat. But I think the stigma is that escape from vulnerable. I don't really want people to see what I struggle with. And in psychology and marriage and family therapy, there's not a lot of places. If you have a good clinician, there's not a lot of places to hide.
Yeah.
And so that's scary. And I think that's scary in the church, too, because we talk about our hope and we talk about what we believe Christ's doing, and then we have these struggles. And how does that fit together? And the discontinuity between that is unsettling. And being able to sit with that and train my students to sit with people in that unsettled space, but getting people to get there is hard. Getting my students to get to that unsettled space is hard. But I tend to be very good at making people anxious. So that's a gift God has given me.
Well, as you say, though, it boils down to this. If you knew me, you wouldn't like me.
Exactly.
I mean, that's a lot of it. Or I'd feel threatened if you... Tell me a little bit about this new program at Wheaton, now just a couple years old. How do you feel about it? How are students feeling about it? You just graduated your first class, right?
Yeah, we had our first graduates this May, and it's been really exciting to see what God is doing and how this has come about. My goal as program director is to stay out of God's way, because it seems like He's really moving in interesting ways in this program. It started in 2012, and we had an incoming class of 18, and they've graduated. We've hired 2 more faculty members. So the first year it was just me. I felt horrible for the students that they were stuck only with me. Now we have a faculty of 3. We're working on seeking accreditation through our accrediting body, and people are getting very excited. Probably half of our students are missionaries and international students that are really interested in coming and training and then going back to their home countries or the mission field to serve families internationally.
Yeah. What would you say to a person who's hearing this and considering Wheaton maybe what kind of person, what's the profile of a person who would come here for this?
Yeah, we're an academically rigorous program. But that's not the identity that we're seeking. Our mission is expressed in our 3 or 4 learning outcomes. We want to train competent clinicians. So if you have a heart for relationships and thinking about relational brokenness and coming alongside people and giving example of who we are in relationship, that's who we're looking for. The program is about who you are. We tell our students you're going to be the tool in the room. It's not a technique-based thing. It's how you're going to be living out relationship and doing the dance in the room with them. That'll give them a new experience. And so we're looking for relationally skilled. So we seek competent clinicians that are relationally skilled, that have a sense of interpersonal justice. And what we mean by that is our mission is to not only have private practice and work in wealthy communities, but really to serve the underserved and those on the margins.
I'm hearing that show up in several people who I've had in here.
Yeah.
As a hallmark of the Wheaton program.
And I think it's part of the college mission that then the graduate school and the clinical programs are congruent with. It's where on the margins are we going to meet people, and that's what Isaiah 61 was about too. Of as the Lord used that in Matthew of calling forth His ministry, of look at I'm healing the blind, I'm meeting the sick and those that are poor, and we're looking for people that are interested in working in those communities and coming alongside. And then lastly, distinctly Christian integration. A lot of the integration that's out there in psychology is about the individual and Christian faith. And so we're looking to really train clinicians to think systemically, think about this Trinitarian kind of perspective of our image is relational. What does that mean? And how does marriage and family therapy and Christianity fit together, and where it doesn't, and how do we navigate that? So those are the characteristics of our program that we're looking for good fits of students.
Well, if you're interested in that, sounds like something you'd like to take a look at. Visit wheaton.edu, where you can find more information about the marriage and family therapy program here at Wheaton. Dr. David VanDyke is the program director and associate professor of marriage and family therapy here. David, it's great to have you here.
It was wonderful talking with you, Greg.
Thank you so much.
Thank you.
For Inside Wheaton, I'm Greg Wheatley.